Hello parents, myself Dr. Anupriya. So in this course, we'll discuss about abdominal pain in kids. So first we will discuss about what is abdominal pain, then age-specific causes and symptoms of abdominal pain, its accompanying symptoms, when should you be worried, the red flags of abdominal symptoms, how do you manage it at home, dietary changes during abdominal pain, constipation and its management, and prevention of it. What is abdominal pain? So any discomfort which is felt in the area between chest and pelvis is termed as abdominal pain. It is often called as tummy ache and it is common in children. The pain can vary in intensity, duration and character. It might be mild and fleeting or can be severe and persistent. But it's important to remember that abdominal pain is only a symptom. It is not a disease in itself. It signals that something is happening inside the digestive system or any organ in the body which you need to take care of. Next, age-specific causes of abdominal pain. First, we'll see in infants that's between 0 to 12 months of age. So it's colic. It's extremely common, peaks at around 4 to 6 weeks, plateaus by 6 to 8 weeks and goes off by 3 to 6 months of age. So it's mostly due to the immature digestive system, food sensitivity, swallowing of air during feeds, or sensitivity to certain food items which the mother has if she is breastfeeding. All of this can lead to gas and colic. So the baby will have crying spells, the baby will pull up the legs, turn completely red, arching back, there will be bloating. Second is constipation. So infrequent or hard stools which causes pain. It is usually when the baby is started on solids or when you switch formula. So the baby will strain a lot, cry while passing stools, and will be hard pellet-like stools. Next, feeding issues. Either overfeeding or underfeeding or formula intolerance which can lead to discomfort. So the baby will be fuzzy, they'll be vomiting, constant discomfort, changes in feeding patterns. Next, intussusception. It is serious but a rare condition where the intestine telescopes into itself. So it presents as sudden, severe, cramping pain that comes and goes, vomiting, bloody stools. It's a medical emergency. Next is infections. So viral or bacterial infections can cause abdominal pain. It often presents with vomiting, fever, irritability, diarrhea. Next group is toddlers, that's between 1 to 3 years of age. So first cause can be constipation. It's a very common cause. It's often due to diet, withholding of stools that can be due to fear of pain or busy while playing or changes in routine. So it presents as hard, infrequent stools, straining, pain while pooping, loss of appetite. Secondly, viral gastroenteritis, also called as stomach flu. It's a very common viral infection that causes inflammation in the stomach and intestines. Presents as fever, abdominal pain. Next, food-related issues. Can be due to food poisoning, due to contamination of the food, food sensitivities, or changes in the routine, or eating too much at once. So it again presents with vomiting, nausea, cramps, diarrhea. Next, functional abdominal pain. It is a real pain with no identifiable cause. It is often due to stress or anxiety. There is recurrent pain often around the belly button and it interferes with child's activities. Next, urinary tract infection. Here the pain is felt in the lower abdomen, but it is a very important cause. So there will be pain, burning while micturition, fever, vomiting. Now in preschoolers, that's 3 to 5 years of age. Again, constipation stays the main cause. So it is due to dietary factors or withholding as there is change in the environment. The child goes to play school or somewhere out, the child will be withholding. They usually are not comfortable in passing stool at a new place, at a new surrounding. They'll be straining, they'll have pain while passing stool. As the baby has been withholding, the water gets absorbed and the stool becomes hard. So this becomes a vicious cycle. The baby tries to poop, there is pain, the baby doesn't poop, hence it continues. Viral gastroenteritis. It is still a very common cause in preschoolers. As the babies are sent to daycare, they touch here and there, they eat food with their hands, and you don't know from where everyone else has come, the hygiene which they follow. It's very important to teach your child at this age about hand washing before eating. The baby will have vomiting, diarrhea, abdominal pain, that is crampy pain, fever. Next is functional abdominal pain. It is very common. It's related to stress and anxiety. It's often a vague complaint and it's related to school or any other social functions. Appendicitis. It is inflammation of the appendix. It's less common but a medical emergency. So the pain starts around the belly button and it radiates and moves towards the down. That is the lower right abdomen, accompanied by fever, vomiting, diarrhea. It's a medical emergency. Next, school age children between 6 to 12 years of age. Again, constipation is a major cause of abdominal pain. That is due to dietary habits, lack of exercise, stress also contributes to it. There'll be infrequent bowel movements, hard stool, pain while defecation. Functional abdominal pain is also a cause here. It is related to stress and anxiety, often a vague complaint before the exams or any social function. Irritable bowel syndrome. It's a chronic disorder that affects the large intestine. There'll be abdominal pain, bloating, gas, can be diarrhea or constipation or both. Infections, both bacterial and viral infections can cause abdominal pain. They may present with fever, vomiting, diarrhea, abdominal pain. Appendicitis. The diagnosis may be challenging here. The pain typically starts around the belly button and it moves downwards toward the lower right abdomen. Can be associated with fever, vomiting, diarrhea. It's a medical emergency. Next, we'll discuss about age-specific symptoms. So first in infants, that's between 0 to 12 months of age. So they cannot verbalize. We need to look for the following signs. Excessive crying or fuzziness, drawing their legs up to the chest, arching back, changes in feeding patterns, sleeping pattern, a bloated or tense abdomen. Next, toddlers between 1 to 3 years of age. They have limited vocabulary. So observe for pointing to their tummy, whining or grunting, not wanting to eat, not wanting to play, changes in behaviors, restlessness or irritability. Next, preschoolers, that's between 3 to 5 years of age. They often use these phrases to describe. My stomach hurts, my tummy hurts, it feels like a pinch. Or they may be able to point at the location. School age children, that is between 6 to 12 years of age, can give a more detailed description. They can mention the type of pain. It's a sharp pain, it's colicky pain, it's crampy, right? They can mention the frequency, like it comes and goes, it stays, it's continuous in nature. They can often describe the severity of pain. They can use a pain scale. Coming to accompanying symptoms. So vomiting. Note the frequency, amount, color of the vomitus. Then diarrhea. Again, frequency, consistency, color of the poop. Look for any blood or mucus. Fever. It is a sign of infection. Loss of appetite. The child wouldn't want to eat during period of infection. Changes in bowel habits. The baby might have constipation or changes in frequency and appearances of stool. There can be other symptoms like lethargy, rash, headache, urinary symptoms like frequent urination, pain while urination. Now, when to worry? What are the red flag signs? So first, severe persistent pain. Intense pain which is not subsiding or getting progressively worsened. It's a major alarming sign. Then blood in vomit or stool. This is not normal, it is serious and requires medical attention. Distended abdomen. A hard, swollen abdomen is not normal. It indicates some blockage inside. Now coming to signs of dehydration. Decreased urine output, sunken eyes, dry mouth and tongue, lethargic, unresponsive, irritability, no tears while crying. The baby might get unresponsive or gets very difficult to wake him or her up. The other red flags could be pain that wakes up the child from sleep, baby is unable to pass gas or stool, and vomiting that prevents the child from taking any fluids inside. Next, dietary considerations. Clear fluids for hydration. Offer water, oral rehydration solutions to prevent dehydration, especially if there's vomiting or diarrhea. Bland foods. If your child is hungry, offer them easily digestible foods like toast, bananas, rice. The BRAD diet, that is banana, rice, applesauce, toast. It's the most commonly prescribed but not the only one. Avoid trigger foods. So limit or avoid dairy products. If the baby is lactose intolerant, avoid it. Sugary drinks, caffeine, fried foods, fatty foods. So consider offering smaller, frequent meals. How do you manage this at home? So you need to know the medicines which you can give. Commonly used ones are ibuprofen and paracetamol. So always follow the dosage which is mentioned on the label or prescribed by your pediatrician. This can help you in relieving pain and fever. Never exceed the dose. It's usually based on the weight of the child. And use these pain medications only if your child has severe pain or it is interfering with your kid's normal routine activities and rest. Avoid giving it routinely for mild discomfort. Never exceed the recommended dose. Do not give ibuprofen to infants below 6 months unless and until it's prescribed by your doctor. And do not give aspirin to your child. You can also use dicyclomine, which is available as methotrexate syrup for older children, and in infants you can use Colicaid if you suspect colic. But always consult your pediatrician before giving any medicines to your child. Apart from these medications, you can help your child by giving tummy massages, leg exercises, relieve the constipation, you give plenty of fluids, give ripe papaya, pears, peaches, create a soothing environment, warm bath, and engage your child in different activities. Now, how can you prevent it? First of all, manage constipation. So, increased fiber-rich diet. So, include fruits, vegetables, whole grains which are age appropriate. Encourage fluid intake. Ensure that your child drinks plenty of fluids throughout the day. Encourage physical activity as exercises can stimulate bowel movements. Burp your baby well, give tummy massages, cycling, tummy time. All of this will help you prevent colic and gas in newborns. Make sure your child has a healthy, balanced diet with fibers, fruits, vegetables. Limit processed foods, sugary drinks, junk foods. Maintain hygiene. Teach your child to wash hands frequently, especially before eating and after using the toilet. Stress management. Help your child develop healthy coping mechanisms with stress, as anxiety can lead to abdominal pain.